Great, thanks, Sarah. Again, I'm Molly Heffelfinger, and I'm a family support specialist, and I'm also your room host. Today's presenter is Zachary Rhein. So before we begin, I'd like to tell you a little bit more about today's presenter. Zachary Rhein serves as Iowa's Director for the Aging and Disability Services Division within the Iowa Department of Health and Human Services. Zach has over 20 years of experience working in federal and state government and nonprofit organizations, where he has focused on designing programs that meet individuals' basic needs. While at the Iowa Department of Aging, Zach served as the Director of Programs, where he has led initiatives focused on helping older Iowans maintain their independence for as long as possible. He worked as the RSVP Program Director, developing programs and recruiting volunteers, and as a compliance officer, monitoring Iowa's 6 area agencies of aging to ensure compliance with the Older American Act programs. So I welcome Zachary today. Thank you.
Thank you. So welcome everyone. And today I'm going to talk about our plans at Iowa HHS to expand our ADRC network. So ADRC stands for Aging and Disability Resource Centers. And so I'm going to talk about the way that we intend to do that. About me, you just heard quite a bit about me. I do want to add a couple of things. I have a lot of experience in the aging world, but I also started my career working with individuals with disabilities at Kansas Neurological Institute. And it was kind of a merger of the aging and disabilities world. What I did was recruit and engage low-income, older individuals in Kansas to serve as volunteers to promote the community inclusion of the individuals who lived in that facility. I also grew up with a mother who was a special education teacher in a very small town with a father who was a minister. And our house was kind of the place where people went to get connected to services and to whatever help was available to them. I say that only because that's why I do this work, and I want people to know that. A lot of times you see a person coming in from the state, showing up in a suit, and you think, well, that's a bureaucrat. I'm not in this to be a bureaucrat. I'm in this to improve the way that we serve people. In this case, it's going to be about improving the way that we serve people with disabilities across Iowa. Also important to note, I am a parent as well, and the parent of a child with disability. And I gotta hit the right button. I'll get there. So I'm going to talk a little bit about our disability services system overview, disability access points overview, talk a little bit about continuity of care, and this will not be a very long presentation. There will be a lot of opportunity for you to ask questions. One thing I want to point out from the very beginning, when I talk about this disability service system change or design, it does not affect Medicaid coverage. So we do have some initiatives, a current project called HOME going on at Iowa HHS that is designed to improve the way that we serve Medicaid recipients and waiver individuals, but this does not affect that service. I want to make that clear from the beginning because I think a lot of people get worried when we say we're going to redesign the disability system or create a new disability system. People are like, well, what's going to happen to my current waiver services? This does not affect it at all. So here is our map. And what we're doing is we are creating a disability service system that matches the map that we are currently using for our behavioral health service system. The reason we are able to do this is currently state-funded disability services are administered through the mental health and disability regions, or MHDS regions. Anybody familiar with that? With MHDS or currently receive services through those regions? So that is until July 1st. After July 1st, the two will be separate, and there will be behavioral health system and a disability service system. And one of the reasons for doing this is so that we can ensure that there is a service system that adequately focuses on individuals with disabilities and their families. So these are the region, or the new districts. There are 7, and we have selected 4 entities through a competition to serve as the lead entity for those districts. So there are 7 districts, but only 4 entities, so some have more than one. So if you look at the western side of the state, districts 1 and 4, that is going to be served by Western Iowa Service Collaborative, which currently is an MHDS region in Pottawatomie County, based in Pottawatomie County. District 5, which is in the middle there, is actually Polk County Behavioral Health and Disability Services, also currently an MHDS region. Districts 2, 3, and 6, which make kind of a 7 shape, is going to be CICS, which is currently an MHDS region, but the CICS has changed to Collaborative Individual and Community Supports because they will be focused entirely on disability services. And then District 7, MHDS of East Central Region, which again, currently an MHDS region, but will be solely focused on disabilities. And I point that out that these are current regions because when we talk a little bit about transition, that's actually a big advantage to us because a lot of the people we're serving through this system and that we want to ensure services continue through the transition, they already have information and contact with those individuals. So what's a disability access point? The idea is it's kind of hard to get connected with services, and it's difficult to know where to go and where do I even start. Disability access points are going to be that place. Bright front door, you need connected with services, whether the services you're being connected to are Medicaid or other services, this is the place you will go. So while I mentioned earlier that it won't affect your Medicaid coverage or your services through Medicaid, if you are directing individuals or if you're an individual trying to get connected to Medicaid services or to waiver services, these disability access points will be able to help with that. So they do that by providing reliable information about being connected with services and also advice on decisions. What we see happen a lot is individuals make really big life important decisions with either inaccurate or incomplete information. And that is the idea behind the design of the ADRC system, or an Aging and Disability Resource Center network, which we are calling our disability access points for the disability services. So we want reliable information that people can count on. So service navigation or system navigation. They will also provide service coordination for long-term services and supports that are state funded. So again, not the waiver services, but state funded services. So we have a lot of individuals on waiver wait lists, for example, right? And currently a lot of those individuals receive services through the regions. And they get service coordination. That service coordination will continue for those individuals, but also it will be an opportunity for new individuals seeking services who are on a waiver wait list to be connected with those services and get coordination through the disability access points. They also will provide caregiver services and some short-term services. So oftentimes, so the difference between LTSS and short-term services I'll talk about a little bit more here in a minute. So through this transition from the regional system to our new disability access points, we're really focused on the transition, and we want it to be as seamless as possible for individuals who are currently receiving services. So our focus is going to be warm handoffs for service coordination of LTSS. If individuals are currently receiving service coordination through a region, we want it to be a very smooth transition if we have to transition to a new service coordinator to disability access point. In some cases, since we have current regions that are going to be the disability access points, there may not have to be a transition, right? The same service coordinator may be transitioning to the disability access point and will keep as many as possible of the individuals who they currently serve. We're focused on provider communication and training, engagement and outreach to community and stakeholders about existing and transitioning network, and that's what I'm doing here today. And establishing disability service district advisory councils. So each of those 7 districts will have an advisory council to help guide and direct those disability access points. So the actual services that the disability access points will provide. Reliable and trusted information referral, or INR if you are in the business. Connection to services and resources, and then person-centered decision-making support. So beyond just the information referral, and the way that we will do information referral will not simply be you call the disability access point and they say, well, here is a list of places where you can call to get service. It's going to be much more assistive than that. My expectation is the staff at those disability access points will say, would you like me to call some of these places with you or for you? And then we're going to follow up and make sure that people get connected with services. We want to be more than just a phone book or a list of providers. And then the person-centered decision-making and support is a service that we call options counseling, where you have the opportunity to sit down with an options counselor from a disability access point, come up with a person-centered plan, and then again, we follow up to make, the way that we look at this is the person-centered plan is we give you pathways to accomplish your own goals. So you sit down with the options counselor or do it over the phone or whatever is the best way for you to do that. And we figure out what are your goals, and then we come up with a plan of pathways of how to achieve those goals. Short-term services and supports. So the short-term services and supports, unlike the LTSS, which are expected to be ongoing for a very long period of time, maybe even a lifetime, the short-term services are time-limited activities that support people to live in the home and community of their choice and are provided in an integrated manner, offering support to families and caregivers as needed, again, with the ultimate goal of helping people to remain in their community of choice as long as possible. So examples, some of the examples of this are individual assessment and evaluation. Transportation, there may be a short-term need for some transportation. Respite, peer and parent support, time-limited rental assistance, home and vehicle modifications, adaptive equipment, or other basic needs. But the key here again is that they are time-limited. They're a gap filler. So maybe while you're waiting to be connected to waiver services, you're waiting on an SSI determination, which I realize can take a very long time, but still, at least in theory, is time limited, right? So then the other main service provided by these disability access points is service coordination of non-Medicaid LTSS. So longer term services and supports, and the disability access point will provide the service coordination for those activities. Again, geared towards supporting people to live in the community home of their choice, and also service coordination to provide services for return to community after either a stay in rehab or people who've been in an institution for quite a while who want to return home. So examples of these services are like SCL, supported community living, DayHab, facility-based residential, medical services and supplies, PERS, or personal emergency response systems, supported employment, again, respite, but longer term and ongoing as opposed to a gap filler service, and pre-vocational services. Some crossover here between the LTSS and the short term. And again, the differentiation there is what is the duration of the need. Anyone have questions so far? Yes. Yep.
So how do you qualify for these services as opposed to the waiver?
So the question is, what is really the difference? These services, these LTSS services seem very similar to the waiver services. So what is the difference? How do you qualify? So, and the answer is they are designed to be very similar, and they are oftentimes the same service. There will be a needs assessment, and also the income level for these services is higher, so it's 200% of FPL instead of 150% that it would be for the waiver. Yes. So the question is, does that also give you access to Medicaid? And the answer is no, it does not, which is another difference between waiver services. Yep. So it is for individuals who are not covered by a waiver or not covered by Medicaid.
So when we're talking about somebody new to the disability community, it sounds like this is a place that they could get referred to kind of talk with somebody who's going to give them valuable information. Would this also be a place that would support them in like completing a waiver application, or is that still going to be referred to like, you know, the HHS Department of Health?
Yep. So the question is, would this also be a place for individuals to get assistance with completing a Medicaid application? The answer is absolutely. Yep. So you come in and we can't do the eligibility determination for the disability access points. Only HHS can do that, us at HHS. But the disability access points absolutely can sit down with individuals and help complete applications for Medicaid and Medicaid waivers. Yes.
And so people can come with birth, like at birth to however it's covering all.
Yep. The question is, what is the age group covered? And it is 0 to however long people live across the lifespan. Correct. Yes. Yeah, so the question is basically how long will you wait on a waiver wait list? And the answer is we don't really know, but it can be a very long wait.
They told me to call HHS and see, because they told me 3 years. And then they told me to call HHS, and it might be sooner because she's on disability now. And I could not get through no matter how hard I tried.
Okay, so the question is trying to get through to HHS and having a hard time. I would like to talk to you directly after we finish this presentation. We can talk about what some of your options are. But I would tell you that going forward, I will be able to say, call your disability access point, because there are other things that can be done, and there may be services that you could be connected to that you currently are not. But I certainly want to follow up with you after we finish here. Yes?
How does this plan overlap with the behavioral health plan?
How did, okay?
I heard that we use disability access points too.
Yep.
Is that the same?
Question is, how does this overlap with the behavioral health plan? So when the bill passed, the behavioral health bill last legislative session and was signed by the governor, it split behavioral health and disability for the first time. And it said, we're going to create behavioral health districts, and then the disability portion of that gets moved to the Aging and Disability Services Division of HHS to be administered. So that was, it's separating them. So behavioral health had a competition, and they established one organization through that competition to serve every district in the state as the administrative services organization. And it is behavioral health specific. This system, we have selected 4 entities to cover the same 7 districts, but to focus solely on disability. The way that they will interact is if it is so they will also be doing navigation for behavioral health services, but focused very much on prevention, short-term interventions, and recovery. If it is a behavioral health issue that becomes a disability, which is often the case, then that would be administered through the disability services system. However, we are working in terms of the system navigation between that ASO, which is what they call the behavioral health organization, and our disability access points. What we want is a no wrong door system. So when people are trying to be connected to services, we feel that people who are out there looking for services don't really care who the payer is, right? And they don't really care, like you have to call this for that and this for that. No, you get connected at one place, and then we figure out who's funding it, is our goal, and we're working hard to achieve that. So does that answer your question? I think the difference between the two is if it is behavioral health, it is the behavioral health system. But if it is behavioral health that is long-term and is a disability, then that would be through the disability service system. But the two systems have to interact with one another.
And they're with substance abuse too. That one.
Yes, substance abuse also is with behavioral health. Yes, but again, goal here is no wrong door. An individual calls a disability access point or the Administrative Services Organization for Behavioral Health should be connected to services. Yes, that's why I'm here. Just keep asking.
Okay, so regarding the 200% FPL, is that, because like when you go through like the traditional waiver program, if the individual, if they're a child, it's considered a household of their own, or is this looking at the family, the whole household income for that to qualify?
So we'll be doing it in that. So the question is, how do you determine FPL or people's income? Do you do it based on a household, or do you do it based on, if it's a child, the child can be considered a child on their own? We will be doing it in much the same way that Medicaid does. Yeah, and there also will be, even though we have the FPL, we do in cases where we can determine that there is a really high need, we do have the opportunity for exceptions to policy. Yes?
So all these services here, are these for people who are not on Medicaid or on a wait list?
So it's for people who are not on Medicaid.
Yeah, everything that you're talking about here this is like people who are not like on a waiver.
Yes. Most of the time. So currently, as most of you probably know, there are some waivers that don't include all of the services that other waivers do. So if we have an individual on a waiver who has a need for a service that is not covered by that waiver, we still can provide services to those individuals.
And I'm in Dallas County. Is Heart of Iowa one of those entities that you're talking
So the question is Heart of Iowa one of the entities? So Heart of Iowa is a current region, but they are not continuing as a disability access point. So, I'm sorry, Dallas County? So Dallas County will be covered by the Polk County Behavioral and Disability entity, which will be the disability access point going forward.
When you show those regions, is there kind of going to be a standardization of like how many physical locations there are? I'm just very rural Iowa, and I'm just wondering like, am I still going to be talking to people and sending them 60 miles to even the closest destination?
So good question. And the question is there going to be some kind of consistency to where locations have to be? So the answer is the disability access points are going to propose to us where their physical locations are going to be in each district. The whole point of this is we can't have a system, because right now I'm sure many people in this room are aware, you have services available in Polk County, and you have services available in Lynn or Johnson County, and then you have pockets of the state where you don't have anything close to that, right? And the goal here with these districts is to ensure that those services are the same regardless of where you live. And so the disability access points are going to propose to us where in those districts they're going to have physical locations. However, I want to point out that even though we have this district design, it doesn't limit where you can receive services. So just because you live in District 4 and maybe you live in Adair County doesn't mean you can't go to Polk County for services. You absolutely still can. Yes.
Is that advisory council going to be part of helping that decision be made in terms of like if that proposal given meets the needs of the area, or is that something that's going to kind of live internally?
So the question is, are the advisory councils going to have a role in establishing where those points exist within each district? And the answer is yes. So each advisory council will play a role along with the disability access point about establishing a plan for how they're going to cover each district. And even though, for example, we have a single organization covering districts 2, 3, and 6, they will have to have advisory councils for each of those districts. And so in addition to that, they will also propose to us a district plan for not only how they intend to cover the district, but what services they will provide in terms of those short-term services. So we want similar or the same services available across the state, but if you live in Polk County, maybe there's another organization that already provides something that you don't have to, right? Versus whereas if you're covering Lee County, the chances of that happening are a lot less. So through those plans, they will establish here that, because let's just be honest, there's not unlimited money, right? And this is a lot of service that we are asking people to either provide or connect individuals to. And so that's really the expectation. If a service already exists and you can connect people to it, that they're not going to have to provide it themselves. Yes?
When do you expect those locations to be known so you can communicate that to the community?
I think June. So this system kicks off and starts on July 1st. Somebody said, wow, I feel that too, believe me. Yes. No.
So the advisory council that is for each region is not something that has like family or folks with disabilities participation and if you're interested, how do you get involved?
So the question is, if you are two parts, right, what will the makeup of those advisory councils be? Will it include families or people with disabilities? The answer to that is absolutely. They must contain people with lived experience, right? Family members, caregivers, people with disabilities themselves. And then how do you get involved? I have a slide in a minute that's going to give contact. Oh wait, it's right here. Not in a minute, it's already up there. There are contacts up here, but they will be doing outreach very soon to start establishing those advisory councils. They have not been established yet. So the question is the HHS website the place where you go to access the disability access point? So starting July 1, we will have a web page where you can access each disability access point, but you can also call them directly. And then in addition, we will have a 1-800 number where you can call and be connected to the disability access point in your area. And that is all coming soon. That will all be on the website, yes, but there will also be individual websites for each of the disability access points. The answer is, will it list on the website the different services you can get? I don't know yet. Because of what is available in each district may differ, that may exist on each individual website for the disability access points. Yeah. So basically just a suggestion that we provide the services that are available on each individual website. So thank you for that feedback. Yes?
If I was talking to somebody and I was like, there's a lot of changes coming and this is where you should go to get the most up-to-date information, what's your opinion of like, because yes, we can dig around on the HHS website and find it, but is Facebook going to be, like signing up for the newsletter? What's going to be like the best way to make sure that as new information is being released, individuals can just stay up to date, like as this timeline to July kind of comes, that
Yeah.
they don't have to go searching themselves, but the information can kind of come to them. Is there a best practice for that?
So the question is, where do people go to get the most up-to-date information? And the answer is, it is going to be our website, but it is, I 100% recognize that right now that is a little bit difficult to navigate and to find the information, but we are currently working on that. But also we're going to be sending out and providing information to organizations, and Ask is one of them, that you can provide to people.
So we'll have statements that we can release like on our Facebook and then our
Yes.
newsletter that can be that.
Yes, we're working on a packet of that information now. Yes.
Trying to swim in the ocean here with you. I'm sure I got two fingers up maybe. My dependent is on a waiver already, they're satisfied with the services we have, and everything's cooking along, and we're working with an MCO. This doesn't need to even be in my brain.
So the question is, if we're currently we're on a waiver, we're currently satisfied with the services that we have, this doesn't even need to be in my brain. I would say you're likely not to need it, but if something changes and there's a change of your case manager and you run into issues, you still might want to be able to contact the disability access point. So even for people who are on waivers, I think what we see a lot of is people don't necessarily know who their case manager is, or there's a change, or they're concerned about something that is happening. It's still a place that you can contact. Yep. Okay, I'm going to push ahead. Continuity of care. If you are an individual or you work with an individual who currently receives services through a region, those services will continue to happen through the transition. If you currently get service coordination from a region, the Disability Access Point staff will reach out to you in May or June about the transition. And if LTSS services are authorized individuals today, we will honor that. This is really for providers, if there are any providers in the room. We don't want people to lose service as a result of this reorganization or this change. And so probably the way that would happen is the provider says, I don't know for sure that I'm going to get paid, so I'm not going to provide service. So we will honor, if there is an authorization in place on June 30th, we will honor it at least through December. So if you are a provider, if you have connections to providers, please help us get that word out. We are currently working on a letter because I'm sure providers are going to be like, well, that's nice. We've heard that before from a lot of different places, right? Like we need to see that in writing. So we are working on that. But it's very important to us that the individuals do not, because the goal is to have a better system, right? And especially through this transition, goal number one is no one loses service. And some helpful links here, as well as a QR code we have an FAQ on our website, which to your question earlier about what is the most recent information, that is a place. And then also to our service system alignment webpage. So this is the actual link because I kind of heard you saying like, well, I go to the HHS website and I can't really find anything. So there was a link right here that will lead you directly to that page. What we're currently doing is trying to merge the former disability services page, which our alignment page, because we're moving past alignment into just having a service system.
You might already be bringing this up, but also your town halls are another area.
Yes, thank you. And so we recently have started having town halls, and we have 2 a month. We've had our first 2. One is really geared toward providers, and the other is geared toward the public or individuals who are either currently receiving or seeking services. But really, the information is the same in both. We get a little bit more into how payments happen with the providers, but if you're an individual looking for receiving services, my goal is that you don't have to care about that, right? Your service just continues. So, thank you for that. And that is the end of the presentation, but I have plenty of more time here if anybody has additional questions. Back up, yep. I think I can back up. Give me a second to figure that out. There we go. Yeah.
Could you expand a little bit? You talked about caregiver services. Is there anything currently that exists in the system that you feel like would be ongoing, or you feel like these are new services that are going to become a priority for development?
So I think respite is the one that comes to mind that I know is at least somewhat consistently available across the state, but also like caregiver support groups, caregiver training are things that come to mind as well. Yes?
I hear from families that care for those with disabilities, and they are having problems with income, with getting income. Is that something that you'll be able to help provide service or direction to on other ways that, maybe like with SSI or things like that, on how to get income for those with disabilities?
So the question is are there going to be programs to advise individuals with disabilities on how to get income? So certainly in connection to SSI and assisting through that process, but also through employment programs. Yes. I mean, employment is going to be a big focus going forward, right? Like so we currently have the transition and we want to get through that without people losing services. But then employment is first and foremost on our minds at HHS. We have a lot of people who want to work and we need to help them do that and support them. What other questions do you have? Nothing off limits. Try to answer everything. Yeah.
I'm just really excited to learn about this. I guess it's probably been around for a while, but I work with a lot of families in western Iowa, and my daughter, she's on a waiver already. But there's a lot of families that I know that are, in the transitions where it's like, what's going to happen? We're still on the wait list, and it may be a while yet once they graduate, but there's some place that they can still access some of those employment
Yeah.
benefits or, services, and to keep them with their job skills and like those types of things. I just think this is hoping for where it gets out.
Yes, so really it's a statement more than a question. It's like maybe this has been around for a while. So, but here's the thing, it hasn't really been around for a while. Because part of the reason for the separation is we have to have a place that focuses on services for people with disabilities and their families. And that's what this is. And I don't want to give the idea that we're going to solve all problems for all people, right? But the goal of the disability access points is we're going to connect you with services that exist. And we're going to figure out what we need to be funding that other people aren't. And the reason, so it hasn't been out for a while, and we haven't even really been talking about it that long because we didn't have signed contracts with our disability access points until April 1st. So there's been a lot of information out there about behavioral health and about that redesign, right? Because they went first. We had kind of limited capacity to go through the whole contracting process and select these entities. But now we're at a point where we're getting out and talking about it more. So I'm also incredibly excited about it, right? Because we get a lot of questions. Where can I go? I don't even know how. And what we hear more often than anything from people is, I don't even know where to go to get connected to services. And now we will have a place and we say, this is where you call. This is where you go. Bright front door, no wrong door system. And that is what we're striving for. Yeah. So the question is, if a child is on a children's mental health waiver, what happens when they become adults? Do they just transfer to a new waiver? So I will tell you, kind of outside of this project, we have what's called the Home Project going on at HHS, which is the timeline is a little less specific, but within the next couple of years, we are redesigning our waivers. And we're going from, 7 waivers now to 2. And there will simply be a child waiver and an adult waiver with services based on the assessment and what's the individual's need, not on the diagnosis. Back to the point earlier about how like certain waivers have certain services and other waivers don't. We don't want your eligibility for services to be based on your diagnosis. It should be based on your need. So the answer is, right now, they would have to transition to a different waiver. In the future, there would just be a transition from child to adult, which would be the same regardless of whether it was the mental health waiver or ID or something else. So the question is, when does that start? We have changed the timeline a bit, so we are hopeful that it happens in calendar year 2026. But that's another thing that we will be providing updates on our website, but also after July 1, our disability access points will be armed with that information as well. Yes?
So as someone, parent, but I also professionally work with families and stuff, so if I just have a question or I want to, could I call the access as well just to kind of ask some questions, or is there someplace else for someone in a more professional capacity to get those questions?
So the question is are these disability access points only for individuals and families, or can professionals call there to get information as well? And absolutely, we want professionals calling there as well.
So in the past, when there's like a new program, HHS has done a really good job recently of kind of doing like a training kind of geared towards like case management, like, and then they put it on the website. Do you think that once there's kind of a very systematic answer for how to guide families, that would be available so that anybody could really watch that if they wanted to educate themselves on like that idea of no one's going to get false information out there. Everyone's going to kind of have the same expectation for like the messaging.
Yeah, so the question is really like, how are we going to train people? So in addition to the disability access points, we also have a contract with the USED at the University of Iowa to provide training and technical assistance across our ADRC network. And what we see as the ADRC network, so in addition to the roles that I've described for the disability access point, they're also charged with establishing a network of ADRCs within that district, either both official and unofficial. And so what the USED will do is make that training available to all of those entities. So regardless of whether or not like Ask Resource Center decides, hey, we want to join the ADRC network, that information will be available because we know you and other organizations, people are going to go there for information. And we want you to have the same information that everybody else in the network has. Yes?
Assessment that is being done, is that changing in any way? Should we stay the same process? And if so, what can we get training to be prepared to do those assessments?
So the question is with needs assessment, is it changing at all? So the needs assessment as part of the home project, there will be changes to that for Medicaid and there will be training available. But the timeline on that, since I'm not quite sure yet when that is, the training is not yet available.
What kind of training are you doing?
100% honest answer here is I don't really know because that falls outside of the area that I oversee. Do you have a suggestion about what kind of training you would like to see? I can certainly pass that along.
Would love to be able to have someone sit down and explain the question and what they're looking for an answer. Otherwise, you have some stranger show up in your house and they've got a timeline and you have to get through 90 or 100 some questions. Sometimes you don't understand the question, don't understand how to answer in the context of the situation we're in. So if there was a way to prep for that, it would be more meaningful to us, certainly more meaningful for the state to have better information.
Okay, so the suggestion is that we have like the ability for people to prep for those assessments so that they can be kind of smoother going through the process and it's not so onerous. I will most certainly take that back to my colleagues in Medicaid.
Understanding questions for me is the key. The first
Yeah.
thing you can do is say, we're not using these, don't worry about it, it's gonna sit on the shelf. It's like, no, you paid somebody to come out here, it's the second year they're done, you can't tell me this information isn't useful to someone, so they wouldn't be doing it, and therefore, we should be armed to be able to answer the questions most meaningful way possible to represent the person that we're representing.
Yeah, thank you for that feedback. And like I said, I definitely will pass that along. I know that that is one of the goals, right? Number one is we don't want people assessed in the same way over and over and over again. And we don't want people asked the same question a million times. So that is our goal and we are working on that. And I certainly appreciate your feedback. Yes?
I'm a little concerned about the East Central Behavioral Health taking over Disability Access Point because we worked with them. I trained family peer support specialists for the state. We worked with them as a behavioral health agency. They kept the same name, but they're now in an ADRC. So will people not get confused about if they're going to the ADRC or behavioral health system?
So that's a good point. If some of these names are the same and they used to be behavioral health system, there's some concerns about whether or not people will actually know to go there. And so I'll say two things, that those are the current names of the entities, and some of them are actually changing their names, but until you have a signed contract, that's a little bit difficult to do. And then after so they may be considering changing their name, number one. Number two, that is a problem that we will solve. Right, of making sure that people know that that's where to go. But I agree with you. And for that reason, some of them have already changed their names. Yes, but it kind of causes some problems. We have a contract with the state and you're like, now I changed my name. So we're working with them to figure that out. And we're also working with rolling out branding that they will all be required to use. So they will all be required to co-brand with us with a logo that says ADRC to make it clear that that's what they are. But I appreciate that feedback too. Thank you. Other questions? Yes.
I'm saying, what I'm understanding, maybe I'm not alone with this, with our, I'm gonna say consumers, kids, whoever, if they're getting Medicaid, this is all out the window for them.
So
Because they don't qualify.
it's out the window. The question is this out the window for kids who are currently getting Medicaid? Not necessarily, because if there are additional services that are not covered, disability access points may be able to connect them. And also if there are, like I mentioned earlier, I think the change of a case manager, for example, and they're not quite sure how to contact that person, or what we see a lot of times is people who aren't quite sure what questions to ask of the case manager or how to communicate with them, and the disability access points can assist with that as well. So
Some of that, though, the communication is an issue. We have to advocate for these people, our consumers, our kids, whoever, or ourselves if that's the case, and ask those case managers those questions. Because you got the information.
yeah,
And I know that the one that I'm with, they contact every month. Anything you need, anything that's going on, you know, how's it going? All of this. If I got a question, all I gotta do is ask, and they'll find the answer for me. And that's through the MCOs, with the labor.
that is great to hear, actually. And if that's the case, then I would say then likely you may not need much contact with disability access points.
But this would be for somebody who doesn't have the MCOs, the waivers,
Correct,
or Medicaid.
correct.
Example, if I needed something along that line.
Yes, or if you have somebody who for some reason loses Medicaid for a certain period of time, that's when the disability access points would kick in. Because we know that we have,
I truly love the switch they're making from the child mental health waiver, the ID waiver,
yeah,
the whatever, because when they hit 18, they're pretty much done, unless they qualify for the intelligent deficient waiver.
yep, yeah.
And, yeah, we went through that.
Yeah, I mean, that's one of the goals is to get rid of, I mean, it really is supposed to improve the system, right? Like we don't want it to be so hard to be connected to services, and then we also don't want it hard to be hard to continue to receive those services.
So would I still have the adult, hang on, the ill and elderly waiver?
So the elderly waiver,
Ill and elderly is what I understand, it comprises both.
so currently it's only the elderly waiver that is a single waiver, and so I think we're not 100% sure on this, that the elderly waiver would be rolled into the adult waiver, but we have kind of gone back and forth on that, on whether there still should be an elderly waiver in addition to these two. Yeah. Yes. Yeah.
For child health specialty clinics, so we're concerned with children 0 to 21. And when we see disability put together with aging, we worry that there'll be services for adults with disabilities and people who are aging, but the children will be left behind. So we're just wondering, are the children on your radar? How big, what kind of services for children are you thinking in these disability access programs?
Yeah, so the question really is, I think two concerns there, right? Like number one is if it's going to be disability, how do we know that the children are going to be served there? But then also there's always a concern when aging and disability goes together that it's going to be all focused on aging, right? And so what I will tell you is this is new, that children will be eligible for the services as well through this system. And we very much have a focus on starting very recently on doing outreach to people to make everybody aware that that's the case. As far as the aging and disability piece, we already have aging-focused ADRCs, and they are our AAAs, our Area Agencies on Aging. They continue to do that for aging. There is a reason why we're not asking them to do it for disability services, because they are the aging people and they are the aging place. The current system of ADRCs is we only have the AAAs. Right? And if you are looking for services for a child with a disability, or you are not 60 and you have a disability, why would you ever call Aging Resources of Central Iowa to be connected to services? Right? You wouldn't. And so that's why we're doing it this way, because there needs to be a bright front door, a place where people know that's my place. That's where I go. So that's the difference between the aging and disability. And it's interesting too, like the combining aging and disability. The disability community, bless you, always I hear, we're afraid that we're going to get lost. And the aging community says, we're afraid it's going to be all about disability. So my job is to make sure that one is not favored over the other. And very much committed to that. It is, it is.
With ADRCs,
That's a good question. So the question is, well, there's a lot of talk at the federal level about cuts, and how will that affect this? So I will tell you that currently, the way that we fund our ADRC on the aging side, and will fund this system going forward, is with state dollars. Okay, so in this system in particular, this disability redesign, we're not using any federal money for this. This is all state dollars. There is the opportunity to add additional federal funds, but it doesn't change whether or not we do this if there are cuts at the federal level. What it might do, however, is drive a whole lot more people to seek services in this system. But it would not, this system change does not rely on federal funds. Any other?
Well, thank you very much. Very informative. I appreciate how willing you are, and I will, this is just my selfless plug. If you do ever have the time, the town halls, I have found them both personally and professionally to be the one place that you can, on a monthly basis, ask the questions, connect to the right person, get your question answered, because I think a lot of it is just, with all this realignment, we just don't understand like how A connects to B to C to D, because we don't always see the linear path. So I would just say to everybody, if you have questions and concerns, outside of today, that those town halls, there's always this like open forum time where there's time to have questions asked. I think last time you did one, I think Alicia and I asked all of our questions, simply because we want to make sure we are directing people to the right answers, and all of the questions were answered clearly, and we were given the answers we needed. So I think it's amazing that you guys are providing that service.
Thank you, and yes, please join the town halls. That's the point, is we want people's questions answered. We want to be able to answer them.